So it's just about a minute after 9. We have a pretty tight schedule today, so we'll go ahead and get started. Certainly people will just kind of be filtering in and out throughout the day. Everybody make yourselves comfortable. And welcome. Thank you all so much for joining us, both in person and online, for what we're hoping is the first annual BCH Behavioral Health Symposium. My name's Wroblewski. I'm a licensed clinical social worker at BCH, and I coordinate the Pillar program. What's the Pillar program, you might ask? Well, we are a program that helps get folks connected to treatment for substance use disorders and management of chronic pain without the use of narcotics. The way we do that is through education and service navigation all across the care continuum. As a social worker, in my career, I've learned a lot of lessons. I started in HIV wraparound services. I spent a little time in pediatrics, and now I do less direct service and more bigger picture intervention. The one constant throughout all of that has been that mental health is healthcare, and none of this exists in a vacuum. We need to take a holistic approach if we want to see the real and sustainable change to support what our clients are facing. One of the cornerstones, so in that, right, building community, building safe networks and safe spaces. One of the cornerstones of the Pillar program is something that we steal a lot from a guy named Johann Hari, and it's that the opposite of addiction isn't sobriety, but connection. So today is also World Mental Health Day. I don't know if anybody knew that, but October 10th is World Mental Health Day. And the overall objective of World Mental Health Day is to raise awareness of mental health issues around the world and mobilize efforts in support of mental health. This day provides an opportunity for all stakeholders working on mental health issues to talk about their work and what more needs to be done to make mental health a reality for people worldwide. It made me think that that relates to the saying, if you want to make change, you need to think globally and act locally. And I know that the work that's being done here in Boulder and all across Colorado is a real testament to that and elevating the discussion around mental health and the services available for people. It aligns with the BCH mission of to care and create for the healthiest community in the nation. So today we're going to do just that. We are going to talk about community. We're going to showcase and celebrate the services at the hospital and how we collaborate with our community partners across Boulder and how we can support folks in their struggles anywhere along the continuum. Our CEO, Dr. Rob Vissers, couldn't be here today, but he did want to welcome you all as well. And he recorded something not long ago. Let's see if...
Hello, and welcome to our inaugural Behavioral Health Symposium. It's hard to believe that this marks the 5th year of the Della Cava building. And I can tell you, when we opened this amazing facility, the intent wasn't for this to be the end, but frankly, the beginning. And since that time, we've significantly expanded the services for our behavioral health patients, not only in this building, but also out in the community. I also want to take this opportunity to highlight the newly named Center for Interventional Psychiatry. Within this, we offer advanced therapies for severe mental disorders that are not responsive to traditional therapy. This includes transcranial magnetic stimulation, or TMS, electroconvulsive therapy, as well as ketamine infusions. We are also expanding our services for those needing treatment for substance misuse disorders. I'm also excited to share that we are now up to 6 experienced expert psychiatrists to care for our mental health patients. Our continued expansion of our behavioral health treatment is in line with our overall philosophy of treating the entire patient. Every one of you is aware of how critical mental health is to your overall well-being. And to try and separate mental from physical health just doesn't work. So we're incredibly proud to offer these services not only within the Della Cava Pavilion, but outpatient and integrated into our primary care practices. I'm so grateful for the support of the foundation and the community to invest in us and our services so that not only we can treat the whole person, but we can treat every person. A phrase you've probably already heard and will continue to hear throughout the day is one of our core values: no wrong door. No path is wrong, whether it be through your primary care provider, the emergency department, or the crisis line. Our intent is to be available to all of those in our community whom we serve. So I wish you a wonderful day. I hope you learn a lot, and we have a great deal to celebrate. Thank you.
I hope everybody feels down-regulated and relaxed. And thank you, Mike, so much for leading us in that exercise. The next person that I will introduce is somebody that I'm very grateful for, has always been a huge supporter of mine and the work Pillar is doing, and is a real champion for moving the work forward with behavioral health. Please welcome Grant Visser, the BCH Vice President of Community Health and Engagement and our foundation president.